Movies and TV shows have taught many of us to think that a stroke strikes like lightning out of a clear sky. A person feels fine, and then suddenly everything goes wrong. But in real life, your body is much smarter than that, which is why it usually sends warning signs ahead of time. Most often, those signs appear about 72 hours before a stroke. The problem is that most people do not take them seriously. They blame everything on age, fatigue, or stress. In medicine, this is called a TIA, or transient ischemic attack. In essence, it is the beginning of a stroke, when blood flow in the brain starts to become disrupted and a certain area stops getting enough oxygen and nutrients. This can happen because of a clot blocking a vessel or because a vessel ruptures. With a TIA, the body is trying to sound the alarm and warn you that something is wrong. At the same time, the body may temporarily patch things up on its own, so to speak. That is why TIA symptoms may last only a few minutes or up to an hour and then disappear completely. According to statistics from the World Health Organization, 99% of people who experience warning signs like these ignore them, and after they start feeling better, they do not go to a doctor. Then, 72 hours later, they find themselves fighting for their life because of a stroke. If you do not want to end up in that situation, the first thing to watch for is the earliest warning sign of all: sudden loss of vision. And it is important to stress that this is usually not complete blindness. More often, it feels as if someone suddenly pulled a gray curtain down over one eye. Some people describe it as a shadow, smoke, a black spot, or the feeling that a light bulb flickered somewhere inside the head. The most dangerous part is that the symptom passes quickly. Within a few minutes, vision returns. Moments like that, especially in older people, are often dismissed as a sudden change in body position or high blood pressure. But a symptom like this can mean that blood flow is already being disrupted, especially if it happens on only one side. A neurologist I know often says that the eye is a piece of the brain on the outside, and that is true. The blood vessels in the eyes are very closely connected to the blood vessels in the brain. That is why vision problems can sometimes be the very earliest warning sign. The second warning sign is numbness on one side of the body. A lot of people have heard about this symptom, but most of the time the information they have is misleading. Most people imagine full paralysis, when in reality it may be nothing more than a mild tingling running down the entire right leg or a loss of feeling in the fingers of the left hand. But more often than not, it starts closer to the brain, in the face. A tingling sensation in the cheek, or the feeling that half of your face is somehow not yours. In moments like that, the best thing you can do is walk over to a mirror and try to smile as widely as possible. If the corner of your mouth on the left or right side does not lift, that is absolutely a reason to worry. The third warning sign, loss of coordination, is the one people ignore most often. That is because it usually shows up as sudden clumsiness or a loss of balance. Most people just laugh it off and blame it on getting older, when in fact it may be a distress signal from the brain. It is especially dangerous when balance starts acting strangely. For example, a person may be walking in a straight line and suddenly begin drifting to one side, or they may suddenly struggle to get a key into a lock, or their hands may become oddly uncooperative. There is one simple thing many people underestimate. The brain controls coordination the way a conductor leads an orchestra, and when part of the brain begins to work less effectively, the body loses precision, sometimes only slightly, but that slight change can be the brain's very first cry for help. The fourth warning sign is speech problems, which again, many people do not interpret correctly. That is because the person usually does not lose speech completely. Instead, they begin mixing up words in a strange way or forgetting them altogether. Sometimes the speech sounds normal to them, but to everyone around them it seems thick, slow, almost as if the person were heavily intoxicated. Very often, the person does not notice it at all, but the people around them do. It is especially alarming if this happens suddenly. One moment the person is speaking normally, and the next they begin stumbling over words, mixing up sounds, or struggling to form a thought quickly. Sometimes it is as if the brain hits pause. The person knows exactly what they want to say, but the words simply do not come out. This is a very serious symptom and should never be ignored, even if it passes after 10 minutes. The fifth warning sign, headaches and skin changes such as vitiligo, is talked about much less often because on its own it is relatively rare. It is important to understand that when the body senses danger, it throws all of its strength into dealing with the problem, and that includes activating a system known as physiological analgesia. That is why the headaches are often unusual. It may feel more like a strange pressure from the inside, as if your head were a balloon filling up. As for vitiligo, it is a condition in which the immune system begins attacking pigment cells in the skin, causing white patches to appear. On its own, vitiligo does not cause a stroke, but studies show that some autoimmune and inflammatory processes may be linked to a higher risk of vascular problems. Put simply, chronic inflammation in the body is bad news for blood vessels, and the blood vessels in the brain do not tolerate inflammation, high blood pressure, high blood sugar, or damage to their walls very well. That is why doctors are talking more and more not only about the stroke itself, but about the soil in which it develops, and that soil is often built up over years. If a person has blood pressure spikes, diabetes, excess weight around the abdomen, sleep problems, constant stress, smoking, and chronic inflammation, the blood vessels gradually become less flexible, and one day that can lead to a stroke.
So if you notice even one of these warning signs, there is a good chance you may have about 72 hours before a stroke happens. First of all, do not waste time waiting. Call a doctor or ask someone close to take you to the hospital right away. Under no circumstances should you drive yourself, because your condition can suddenly get worse at any moment. And do not try to treat yourself. At this stage, what you need is not pills or miracle remedies. What you need is the right medical testing.
The most important thing is the history. Your doctor needs to know when the symptoms began, how long they lasted, and exactly what you felt. That is why you should make sure to write down the time when the TIA happened. Then be sure to ask your doctor for an MRI so you can clearly understand what kind of damage, if any, the brain has already faced. It is also very important to insist on a detailed check of the carotid arteries, which carry blood to the brain, as well as the arteries closest to the heart. Most often, that is where a stroke begins. If you want to avoid a stroke, prevention has to be taken very seriously. There are no pills that can guarantee your safety. Real health comes only through control and discipline. The most effective thing, the thing that truly worked, is blood pressure control. High blood pressure is called the silent killer for a reason. It can damage blood vessels for years without pain or obvious warning. The second key factor is movement, but that does not mean you need to run marathons or spend hours in the gym. Even a simple daily walk helps your blood vessels work better. Blood starts moving more actively. Blood pressure comes down. Blood sugar becomes more stable. The third factor is sleep. Poor sleep is genuinely linked to a higher risk of stroke. This is especially true if a person snores loudly or has pauses in breathing during the night. The brain cannot recover properly if the body is going through a kind of mini-stress every single night. It is also worth taking a closer look at your diet. Your meals should contain less ultra-processed food and more natural fruits and vegetables.
It is important to understand that the brain is not some separate part working on its own. It is deeply connected to every system in the body, and the most important idea in all of this is actually very simple. Do not ignore strange signals from your body just because they passed. The body rarely starts by screaming. Usually it begins with a whisper, and a stroke is exactly the kind of situation where that whisper can save your life, if you hear it in time.
Subscribe to the channel if you found the information in this video helpful, and be sure to share this video with your friends and loved ones so that everyone around you knows the warning signs of a stroke.